Moxo test results are presented in two reports, an attentive cognitive report and a behavioral report. The attentive cognitive report shows the patient's profile in comparison to his or her norm group, which is determined by age and gender. In this report, you can view the examinee type and the criteria table along with the severity table and the legend. Let's begin with the criteria table. For each index, the norm group's data is used to calculate a z-score, which is then categorized into one of 4 performance levels as follows. Level 1 is highlighted in bright green and indicates a high above average performance. Level 2 is highlighted in olive green and indicates a standard, slightly below average performance. Level 3 is highlighted in yellow and indicates a weak performance within the low norm range. Level 4 is highlighted in red and indicates a difficulty in performance that deviates from the norm range. Note that the z-scores themselves appear within the corresponding square. For example, this profile represents an individual with a high performance in the attentiveness index, standard performance in the timeliness index, weak performance in the impulsiveness index, and deviated from the norm range in the hyperreactivity index. Now let's take a look at the severity table. This table only specifies the level of severity for indices in which performance was found to deviate from the norm range. The 4 severity levels are also defined by z-score ranges. The higher the severity level, the more the patient deviated from the norm group. For example, in this criteria table, the hyperreactivity index was the only one that deviated from the norm range, and is therefore the only index showing a severity level. In this case, the severity level was level 4, within the most severe range. The severity table is useful for comparing performance between 2 or more indices that deviate from the norm. In the profile that's shown, performance is below the norm range in both the hyperreactivity and attentiveness indices. However, you can see that performance in the attentiveness index deviates more from the norm to a more extreme degree compared to the hyperreactivity index. This indicates that inattention is a more severe problem for this patient than hyperreactivity, and that treatment should be planned accordingly. The examinee type is a summary of the patient's profile. The first letter of each index appears, A, T, I, H, followed by a number ranging from 1 to 4 that indicates the patient's performance level in that index. If the performance level is a 4, a severity level will also be specified by adding an S, followed by a severity level also ranging from 1 to 4. Please note that a definition of each index and the various performance levels appear in the legend at the right of the screen. To summarize, the Moxo test results can give you, the professional clinician, the attentive, cognitive, and behavioral data necessary for creating a clear and comprehensive picture of your patient's attentive capabilities. This video provided a general overview of the norm table. For more information on Moxo, please watch the other videos.